And certainly with the average cost of, well, we'll just say 3 days in a hospital nationally is coming in somewhere around $30,000. Broken leg, 7,500. These are just national averages. But I don't know about you, but I don't have that kind of money laying around. So major medical insurance, 70 and 80%. We know it doesn't cover everything. Health insurance doesn't cover 100%, but I would like to have 70 or 80% covered. That gives me a peace of mind. So that's what health insurance is designed. It's designed for, to cover the major cost. And also major medical has preventative screening. So when it comes to early prevention, we all know that that's key. So things like the mammograms, the flu shots, the bone density, colonoscopy, cancer screenings, all of those come. And so we know how critical it is to find things early. And then finally, major medical insurance, and also prescriptions. So we in the field, we see the cost of those three heavy hitters, you know, the eye drops, the insulins, and the inhalers. Some of those can run $300 to $500 a month. So again, this all covers, this is covered. Just have a small copay. So that would be my answer, is why do we need health insurance?
Okay, good, 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 good. Debbie, would you like to add something to that?
I have to say, I agree with Joe 100%. And also, the great thing about what we're doing is educating, which is answering questions that you didn't think you had the answer to, but we're here to be able to give you those answers, or you can feel free to contact the office at 817-381-1500.
Okay, good, good. Okay, so tonight, as a matter of fact, we want to just give you a little bit more information, and we're going to ask C. Grimes and Jignacia is going to give us a little bit more information on health insurance. Let me see if I can get rid of this. Okay. All right, go ahead, ladies.
Well, I'll start with the Medicare. Medicare is part A, B, C, and D. And the exciting part about turning 65, I mean, that's just a turning point in all of our lives when we turn 65. And upon turning 65, you're eligible for Medicare. Eligible for Medicare. Also eligible for Medicare are people that are disabled for 2 years. After 2 years, you're also eligible for Medicare, and certain chronic conditions are eligible for Medicare as well. Medicare Part A and Part B is considered original Medicare, and upon being turning 65 or disability 24 months or having those chronic conditions, you receive your Medicare card. And recently they did send out new Medicare cards to all beneficiaries with the new Medicare ID numbers. You can replace your original card by calling 1-800-633-4227 or by logging into your mymedicare.gov account. Also, we have special need plans. We have the duals, which will be our Medicare and Medicaid beneficiaries. They have both. We have our chronics, which includes our diabetics, congestive heart failure, COPD, and new for 2021, anybody that has ESRD, which is end-stage renal disease. And we have our institutional beneficiaries that are in nursing homes. These are all considered special need plans.
Okay.
And when we talk about the ABCs of Medicare, as I said, original Medicare is Part A and Part B. The Medicare Advantage is Part C. It has all the benefits of the original Medicare, plus it includes Part D and many extra benefits like dental, vision, acupuncture, foot care, hearing, the meal program, the nurse hotlines, the OTC debit card. OTC is over-the-counter products. Some companies have debit cards. Some companies, you simply have a magazine, the pictures, and you can just order out the magazine. It's delivered directly to your home. Another additional benefit is the transportation, the virtual medical visits. Now, the virtual medical visits are really important now with COVID-19. A lot of our seniors are not that comfortable going out for little things. They can go for major, but they can do the virtual visits. We have also have the virtual mental health visits and vision as well under the Medicare Part C and the Medicare Advantage plans.
Okay, and so those are just some of the additional. We're running into more additional benefits every day with all the plans, especially that are available right here in Georgia. However, plans differ in different states, but in Georgia they are pretty rich. So at this time, we're going to ask just Nacia if she would give us some information on the Affordable Care Act.
Okay. The Affordable Care Act is a health care reform law that was acted in 2010, and which is called Obamacare. And it had three main goals, primary goals that they wanted to reach, which is to make the affordable health insurance that is available to more people. And also the law was provided for consumers to give them a subsidy, which is called a premium tax credit, that lowered their costs for households with an income between 100 to 400% of a poverty level, and which measures the income that is issued every year by the Department of Health and Human Services. Poverty levels are used to determine your eligibility into certain program and benefits to save money on your insurance, so it's affordable to more people than it used to be. Also, second goal was to expand the Medicaid program, so people that were below 138% of poverty level. um, Not all states have the expansion, but some states. So make sure you check with us and see our state of Georgia is one of those states, so we can help you and guide you if you're below the 138% of poverty level, and see if you qualify for Medicaid program. And third one was to support innovative medical care that delivers to lower your health costs, and that helps you add on more other benefits, which is for people that are below 64 and below. We just talked about 65 and older, and this is for people that are 64 and below. So anyone from um, age 18 to 64, most even children can be covered under their parents if they're dependent until I believe age 26. They can be covered if they're claimed as a dependent on their tax files. And we also have added this year. So these are the information that we would need for us to help you apply for. So your full name, social security, date of birth, address, the county you live in is very important, a phone number, email, number of people on your tax returns. So if you're claiming two dependents, even though they have Medicaid, we still need to have their information because they need to be added in your household member. Employment, where you work, and their name and phone number is very important. And if you're self-employed, we also need type of self-employment you have, like a hairdresser or a business owner, a car shop, mechanic. You still qualify, so you're considered a self-employed, so we would need a detailed information of that. And then we can also add some dental benefits. And there's two ways this is available: health plans that include dental coverage. Now you have to enroll in Marketplace to have the cover. Which we can help you choose the right plan for you and your family, or you can also buy a separate standalone dental plan, which we also help you, and that can be offered through a shop of Marketplace or even outside. So let us know what are your best options for dental, and we can find the suitable need for your family, if it's with the Marketplace coverage or a standalone, whichever one is more beneficial for you and your family. Then we also have some vision benefits, that are added, and which would cover pretty much your eye examen and close to $150 to 200, depending on which plan we put you in, for your glasses. And also, some plans cover children's examination and their glasses. So let us know, your children and their needs, and we can help them find the right plan. If your plan doesn't include vision coverage, we also have a standalone plan, so let us know. Then there is a wellness and fitness program. Also, some plans are offering to help you have add-on benefits, like you can create an account online and create your profile on your needs. If you're diabetic, there's special recipes and special exercise plans that you can follow, and if you follow them, then you get an add-on, like a gift card. There's also discounts added for you to go to the gym membership, and some more incentives to live a healthy lifestyle every day. And there's also like programs to help you stop smoking, diabetic management program, weight loss program. There's also a lot of preventive health screening. So we can create an account online and just fill out survey to see which one best suits your need. And when we're helping you enroll in a plan, we can go over these benefits for you. So if you have more questions, you can ask us about any of these added on benefits: dental, vision, fitness program, along with your Affordable Care Act major medical plan that we choose for you.
Okay.
And that's it.
All right. Well, almost there. I added a couple of more slides. I forgot to add this from the beginning, but we are right at the Medicare annual enrollment period. That means this is when it's like annual enrollment period, when we can write anybody. Time for you to look at your plan, see if there's something out there that you need. If everything is okay with your plan, then you're good. But this is the time that we can go in and assist you in customizing your plan. That's on the Medicare side. Now they give us from October the 15th to December the 7th to write all of these plans. Not much time, so we're ready. We're getting ready. That means Thursday we start writing. We can't write. We can tell you about them, but we can't write any start writing or put any in until October the 15th. And then on the Affordable Care Act, the health insurance starts November the 1st to December the 15th. They give us, what's that, 45 days to write millions of people. So we're going to be real busy, but that's why we're on here on Monday night, trying to get the word out to everybody to let you know that it's open season now, and we can insure just about everybody right now. So with these type seasons coming up. So with that, I think I had, who did I have down here next? Jacqueline Parker. You had something to add?
Sure. Just on your open enrollment, we're talking about it. And we just basically want to ask everyone, are they ready? Whether it's Medicare, whether it's the ACA, it doesn't cost you anything to talk to us. You're getting expert help. There's no money out of your pocket. You do not have to pay anything, not one penny. If we look at your plans and you're happy with your plans, you look at the new plans and you don't want to change, we're not going to do anything to have you change. Earlier, Gail was talking about COVID-19, and it is, it's caused a lot of changes, mostly to when you go to the doctor's office. And I just wanted to go over some of the changes that we notice and that the ACA is putting out there, so that if you call your doctor and it's something that you need to go in, so you can't do the virtual and you want to go in, some of the things they want you to be aware of is, first, you need to call your doctor and check to see if you can actually go into the office, because a lot of doctors are just not taking the appointments the way they were, or they cut their schedule so it's maybe a half a day, or maybe they have alternate days. So first, call your doctor and check. Another thing is to lower your exposure risk. They're saying that you should probably be waiting in your car until the start of your visit. as opposed to going into a waiting area. They're cutting that out. So most doctors are not saying, some do allow it, but if you speak to your doctor, be prepared that maybe they're going to tell you you're going to have to wait in your car. Also, they might have a limited entrance to use. They do this just so sometimes they have people coming out. They don't necessarily need you to be in contact with those people, and they want you to come in a separate entrance. Um, Another thing is most doctors are now asking that you're going to be screened once you go in for COVID-19. It could be something as simple as a temperature check, but just be aware of that. And they're also asking you while you're there to be social distancing. Even if you decide you want to, you don't want to, they're asking you to do that once you go into the doctor's offices. So that's just one more thing to add. And then the wearing of some kind of face covering, whether it's a mask or something. And if you don't have it, don't worry. Most doctors' offices will give you one when you go there for your appointment. So those are just some of the changes that you should be aware of before you go to the doctor's office.
Okay, thank you. That was a lot of valuable information. Who did I hear from? I thought I was cutting somebody off here. That's a lot of valuable information, because if you think you're just gonna go in, it's not, nothing is normal anymore. We just have to be aware of that. We have to be aware of that. And C. Grimes, you had a topic that you wanted to bring to the group tonight.
I was actually going to share a scenario, because when we're working with our clients, sometimes we are not aware of what, we know what they're saying they want, but sometimes we can add to it. I had a client call, she was 57 years old, and she needed life insurance for herself and her son. So when I asked her application, on the application, I was asking her occupation. She said, I'm disabled. I said, disabled? And she was 57. I started thinking, well, what kind of health insurance do you have? She said, well, I have Medicare. I said, you have your Medicare card, Part A and Part B? She said, yes. I said, well, do you have, how long have you had it? She said, I've had this Medicare card since 2011. And I said, well, do you have another plan to go along with your Medicare? Because we know that original Medicare pays approximately 80%, and there's 20% left out there that she would be accountable for if she had an accident or if she was sick in the hospital. She said, yeah, I do have a card. I have my prescription drug card. So of course, that's going to be one of my first appointments this week, because she needs a Medicare Advantage to go along with that Medicare card she's had for 9 years.
Wow. Yeah, I run into a lot of that too. I run into a lot of people. I had someone call me today, say, I got this card in the mail. What do I need? Do I need to do anything else? Am I set? What card? I said, what is it? Red, white, and blue? Yes, it's red, white, and blue. I said, does it have number on it? Yes. Is there a part A and a part B with the date beside it? Yes. Okay, so I'm good. I said, no, we need to have a conversation. So I set up an appointment. We're going to do a Zoom tomorrow and get them, I do the Zoom, we'll do the Zoom and show, we have a little short video that we can tell you all about what Medicare is all about, and just walk you through and let you watch what we're doing. Since a lot of us are sheltering in, we're not, we have to not going, some of us are not going door to door, and those of us that are, we are, make sure that we are protecting ourselves and our clients. But some of us are just doing it through the phone and through the computer. So you're going to run into a lot like that. Has anybody else ran into a situation like that? G?
I have. Yeah, today I had an appointment with the wife, and she's enrolled in a plan, which, but her husband would talk to no other agent ever. And he's signed up in original Medicare since 2011, just like them, but no other prescription plan, no
Whoa.
nothing. And he says, I don't need any. But he just got, he said, I just paid $1,200 for a hospital bill. I said, it's because, they paid 80% and you're responsible for the 20%. And I had to go over the whole process of letting him know that he has penalty that he has occurred a Part D plan that he has not taken. And he didn't like that at all. He was very upset that he didn't talk to the agent when he had a chance to.
Had an
And
opportunity.
so today I educated him on the penalty and how we can help him, go ahead and enroll in a plan so he can have his dental, his vision. And he loved the part about getting it over the counter. And I went over, it was almost 30-minute presentation, but he was willing to listen to me after I had educated him on the penalty part.
Okay, right, yeah. And that's nothing we can really do anything about. Now, sometimes we can help certain people get out of that penalty, but
Which I will, which my client is qualified to get out of that
thank
penalty, and I've educated him on that. So I feel really, happy that we're going to be able to help him get out of the penalty. And I think that we can really educate our clients, he knowing that we know so much information that we have to share, and there are people out there that really don't know these information. So it was definitely people out there that are listening. I've talked to him, and he said, I got two other friends that have the same thing.
Oh, wow.
I was like, okay, we have to do another meeting, but
that's yeah. So that's why we're out here, so we can get that information out there to people. And on the health insurance side, the same thing. We have that one window where we have to really get people in. We can insure everybody. All they have to do is just come and ask us. Now, in the state of Georgia, Medicaid was not at expanded, but there are some things we can go through and try to get you something, but almost everybody we can get you covered. Just don't miss the deadline. I had a family call me today because they missed it last year. They said, we're not gonna miss it this year. Is it that time? I said, oh, you're on my list, but they are calling me now. Almost everybody that I missed it, they're calling me now so that they don't miss it this year, because health insurance, you go to the hospital, but if you don't have that card, they'll see you, but for how long? And what are they gonna do? So it's real important that we have that health insurance. Okay, did anyone else have anything else to add?
Gail, I just wanted to ask Jig, for the people who are on Facebook who don't know what the over-the-counter is, because you talked about it that you're
oh yeah.
client. Maybe you could tell them about the over-the-counter.
Most plans have over the counter where we go to the pharmacy. Everything outside of the pharmacy, there's a lot of medications that don't need a prescription, from your doctor, like antacid and Tylenol. And you also have alcohol, rubbing alcohol, diapers. If you need, you can name anything that is outside the pharmacy. We have a catalog in most of our company's plans, and they give you allowance to go and choose that every 3 months, which is every quarter. They give you certain amount of allowance from $25 to up to a $300. So depending on which plan you are, you'll get that allowance, which is called over the counter, benefits, and that's what it is.
Okay. And speaking of over the counter, I had a client call me today. I said, I'm trying to go in and help, and the number had changed. So I helped them find the number. I said, you can just call it in and give them the number. And she called me back. She said, we had $900 in there. I said, because some companies will let you roll it over to the end of the year. This particular company would let her roll it over to the end of the year. So she said, we had $900. So we ordered blood pressure cups and diabetic machines. And we're going to go back tomorrow and order some more. I said, well, what about her brothers? Because it was three, they live together. I said, her brothers, they have a similar plan. You mean they have it too? I said, yes. She said, oh, we don't have a ball. So they just gonna make a week of just ordering all the stuff. I said, now that particular company didn't roll over, so they have missed 3 quarters.
Wow.
So yeah, I said they said we just forgot. So they're gonna get it in on this quarter. So those over the counter, like Saganya said, some of them are card and some of them are not. Now I don't know if they're gonna add. They do have something similar on the health insurance side. A lot of people don't realize it, but that is a card because I still have some on my card, and I guess it doesn't expire. When I was with the health insurance side, I still have $100 on mine that I can just walk into a store and spend it. And I'm not walking into anybody's stores right now, but I'm going online and spend that. But even on the health insurance side, there are cards, and you can earn. If you go get your annual checkup, you can earn money to go get over the counter things of that nature. So that there are a lot of good benefits. One thing I did want to bring up for people that you hear on the news all the time, people are losing their job, losing their insurance. And I'm like, send me their name, give them my number. We can help them. Even now, even if they're losing their job now, if we get them in time, we can get that insurance started in November. They don't have to wait till the first of the year, but they really have 2 election periods right now. So we just need you all out there to help us get the word out to people, and they can give us a call. Let's say anybody here, we have Stacy and Janet and Veronica and C. Grimes and Joe Beavers and Yesenia and Patricia Park and Terry Sims and Connie Thompson and Jacqueline Parker and Jignacia Patel, Debbie Knight, Kay, all of us are here that you can just call at this number. So remember these names, and when you call, ask, you can call it or you can text the information to 817-381-1500. Janet, put that number up, 817-381-1500. And just ask for either one of us and we'll be able to help you. Even if you just have a question or something you're not clear about, just let us know and we're here to help you. Do we have any questions this evening, ladies?
You know, I have something. I was talking with someone over the weekend that says he believes he signed up for Affordable Care Act last year, and he just wasn't sure. He's self-employed, and his fiance said, "Well, if he doesn't know for sure, then he probably started it and didn't finish it, or whatever." So, so can someone's coverage, I guess, end or expire if they don't make payments? And how many payments will they have to be, behind for it to expire? And how does that work exactly?
Yeah,
and I'm sure we can go in and look them up to see if they're actually still active, right?
Right. If they don't make that first payment, unless that first payment is zero, it's over. That being said, I was talking to someone had called me, said, you got my son insurance. He didn't keep his up, but now his daddy lost his job. He needed insurance. I said, what you mean he didn't keep it up? I said, it was zero. What you mean? Zero.
Oh my
I said,
God.
his was zero. He's been sick all year and hadn't been to the doctor.
Oh man. Oh no.
I said, you've been getting things. You got to look at your mail. So that's let me know, but anyway, so he did get to the doctor. I was able to cover, his daddy. But it was zero. So he didn't make a payment, but he didn't even realize that he had insurance because he had no payment. But if there's a payment, even if it's just $10, if you don't make that first $10, it's over.
Okay.
So that is very, very, very important.
Yeah. Before you move on, one of the things I didn't think about, but right now a lot of people maybe they return to work, but they have reduced hours. So let's say maybe they did a 40, 50-hour week. Now they can only get a 25-hour week or 20-hour week. if that's happened to you and you've returned to work and your hours are reduced, we can help you also. The ACA allows us to go in and you get a totally different amount of what you're eligible for. So don't just assume because you're back working, you're not making the money. Don't just sit there. Call us. Or if you were furloughed, and a lot of people that were furloughed, they're getting unemployment only, and maybe, it's not enough. And they're saying, well, I can't even make these payments. Call us. Or maybe you took a part-time job after you were furloughed. You don't have unemployment. Again, call us. That's what we're here for. Don't just assume because you could have your benefits sitting there and you could be entitled to more benefits that you're not even aware of right now. This is what we do, eat, sleep, and breathe. We can help you.
Right, exactly. Exactly. Very good information. Very good information. Thank you, Jackie. Do anyone else want
I have
to?
something to add.
Mhm.
As far as Medicare goes, the number on the Medicare card changed a couple of years ago, 2 or 3 years ago. And now it's a series of numbers and letters. It's no longer your social security number. Some people still have that old card that has their social security number on it.
Wow.
So they can call Medicare and get them to send the card that has the letters and the numbers on it, because we no longer use that card with the social security numbers on it.
Right. Okay. Anyone else?
Gail, I just wanted to make mention too, just listening to Terry and Jacqueline, that reminded me of a couple of, for instances, I've had people to call or to come into the office that are professionals and took it upon themselves to enroll themselves online to make a mess of things.
Mhm.
They come in as I'm supposed to be the cleanup person. But just having to say that, I wanted to say this. Don't try to be the agent. Don't try to be what and who we are, because we are licensed, we're certified, we're appointed. We are already working with the largest carriers here in the state. Many of us have licenses in other states. We've been doing this for years. We probably have over 100 years combined experience. Just saying that to say, look, if that has happened to you, if you are stuck, or even if you are entertaining the idea that you don't want to talk to an agent, keep in mind the majority of the people in the country don't even have access to an agent. I know people are getting a lot of calls, but we want to be able to help take some of the confusion out. We don't expect you to know insurance. I like to do hair, but I'm not the professional when it comes to doing hair. So I go somewhere to get my hair done. So that opportunity, that's just my cry. Give us the opportunity to help you ahead of time, rather than to come in late after you've incurred penalties and messed things up. We really do want that opportunity to kind of help you navigate through this.
Okay. Great information. Anyone else?
And Gail, can we tell them also how soon they could sign up for Medicare? For example, I signed someone up. It would go into effect December, but I signed them up actually last month. So the window that they have, the 3 months that we can go ahead and get them, signed in or signed up for Medicare.
That's right. For those turning 65, we have that 3 month before your birthday window. Great. Thank you, Connie. I think that's very good information.
Gail, I just want to say, I think a lot of people are held back. Joe was talking about the professionals, that they're professionals in other things, and then they try to do the ACA or something else because it's so simple. Where else do you know that you can go and get qualified help? You don't have to out of pocket any money. We use our time, and if you decide at the end, you know what, I'm not going to use you, that's it. You walk away, but we're here to give you help. So don't be embarrassed or feel like, well, I'm sure it's going to cost something. It does not cost you anything.
Right. And like I said, we have to do a total probably about 20 certifications every year to do what we do. So we have to know this. We have to. And some of the tests you have to make 100 or you don't pass. Some will let you make at least a 90. So we have to know this information. But the thing about it, we enjoy what we're doing. We like helping, and we want to see everybody have the coverage because it's out here for you. So if we don't have nothing's in the chat, Yesenia?
Nothing.
Okay. No questions. So again, we want to thank you for coming, and we'll be here again on next Monday night. Might not be all of us because we're going to be out work. Some going to be out really working on the computer, different things, but we will be here next Monday night, and we'll be bringing you more. Next week, we want to bring you more information on special services that we have, like for people that have chronic illness, such as diabetes, congestive heart failure, the end-stage renal disease. We touched on a little bit tonight, but we want to go more in depth on that. So if you have questions on that, you can send your questions ahead of time by calling the number that Janet had on the screen, 817-381-1500. Like I said, if you have a forum, something that you would like for us to speak either on Zoom or in person, if it's real safe, we can come and talk to your organization. Again, there is no charge for that. You can reach us at the number or our website, which is getting a facelift right now, but it's still usable, GEL helpadvisors.com. So come and join us on next Monday night. Same link, Zoom that you had, and Facebook Live to Let's Talk Health Insurance. So let's talk health insurance. Have a good night.
Night. Good night.
Night.
Good night.
Good night.
Okay, I got